excited to have Joyce joining us. She is going to be with you guys Mondays and Tuesdays here in Trenton, in Chattanooga Wednesdays and Thursdays, and she's available to adjust as the Trenton office grows and becomes open 3 to 4 days a week as soon as we can get there. So excited. Other people that have joined our team: Jessica Smith is a assistant that she's at the Chattanooga office. Camille is doing billing and insurance, and Mary Crabtree is an admin assistant. She's currently a temporary employee supporting the admin team when it comes to getting benefit breakdowns and helping to review the schedule ahead of time. So if you're at the Chattanooga office, you'll get to meet Jessica, Camille, and Mary. Wanting to announce to the team Wendy's promotion to admin coordinator in Hickson. So she assumed that role April 1st, and as you know, we celebrated Trish yesterday at her retirement party, and Trish is on a 2-week vacation. The plan is for Trish to come back part-time to help us with billing and eventually working remote. So I want to update you guys about those changes. Alrighty, next thing is an announcement of our accountability chart additions. There's some people up here you may have never seen before, and I'm going to let Joel talk about this.
Great. So Christy and I have been working with the recruiter to find somebody that can act as what we are calling integrator. We started looking for this role. It was for integrator and director of operations. So we had never worked with a recruiter before. We didn't know who they were going to bring us or what kind of quality candidates. But they did bring us many qualified, wonderful individuals, and we were very, very impressed. We started working with this company called Fiddler and Associates, and it was about the same time that Dana came out and did her training with us. And Christy and I, after that training, were like, man, we should get Dana. Dana's wonderful. We really liked Dana. And so after interviewing several candidates, we were driving, and I was like, Christy, after I'd just been thinking and praying, I was like, we need Tommy and Dana. So Tommy is he was really our top applicant for this position, working with the recruiter, and he and I and Christy connected very quickly on our initial interview, not just about dentistry, not about growing a practice, but around our values. And if we didn't have that anchoring conversation, we wouldn't have had a second and a third and a fourth conversation. And so he has accepted to join our company as what we're calling integrator. And why we're calling integrator, it's a term from the book called Traction. But instead of having titles like CEO, COO, CFO, basically we call it an accountability chart, not an organizational chart, because these individuals, we want to have clarity around what they are accountable for. So Tommy as integrator is accountable for integrating the marketing aspect of our company, the operations aspect, and the financial aspect of our company. And so he will definitely be involved with operations to a certain degree. He will be involved with making sure our facilities are taken care of. He will be involved with probably some of our doctor recruiting and things like that. But Dana has also accepted to come in and help us with operations. So we're super, super excited that these individuals are not just quality individuals that share our core values, but that they are going to be in a position to use their skills and their strengths and their interests to really help us be organized as we continue to grow our group in True Dental. So those are some of the highlights. The two newest names up there, Tommy and Dana. Maybe most of you have met Margot. She's working with us part-time as our director of marketing.
That's the projection there. I thought you know, familiar, at least a familiar face, but as you know, we all really appreciate her training. Super, super smart.
And I want to acknowledge Christy, because Christy is working as our interim integrator and director of operations, and she was handling marketing on as well. So Christy has really been heavily involved with the company, and I love that she's been involved, but at the same time, we're both excited that she'll be able to back out of as much responsibility and accountability as she has that, so she's looking forward to these changes. I just wanna thank Christy again for all the work you've done, putting the time and effort into making sure we're all feeling connected and moving forward.
Well, thank you. I'm very pleased to hand it off to people that really know what they're doing. I've done my best. Anyway, and I've enjoyed it too. So there's that. So, all right. Let's talk about treatment presentation. Let's talk about time off request. Okay, so I'm going to just read this to you. This is right out of our SOP. Employees should access the Google Drive to print off a time off request form. Employees should utilize one form per month. The completed form should be placed in the mailbox of the Director of Operations or sent to me by chat if the mailbox is not at your office. The Director of Operations receives the form, reviews, and approves as able. Approved off days will be entered into the days off requested calendar, which is on the Google Drive and may be viewed by all team members. Only the Director of Operations may add or edit this calendar. Next, the original forms are given to the Director of Finance for review. The Director of Finance will make note of the employees that have requested to use PTO and apply the PTO to the respective pay period. The original form is then given to the admin coordinator of the office schedule that will be affected by the employee's time off. The administrative coordinator will adjust the EagleSoft schedule accordingly and place the time off request in a designated binder. The Director of Operations, Director of Finance, and admin coordinators will date and initial when request is received and processed. So I'm bringing this up because we just swapped I got a little bit more to read. We swapped two things. It's going to go from me to Beverly, then to the admin coordinators in that order. But I want to read a little bit more. Employees may be asked to voluntarily quarantine and be tested upon returning from travel outside the U.S. and our hotspots. This is at the discretion of True Dental. Please consider all universal precautions and recommendations made by the CDC and local governing bodies prior to planning out vacation travel for your safety and the safety of your family, friends, and coworkers. The forms must be completed and turned into the Director of Operations at least 1 month prior to the date requesting off. Just because you submit the form does not guarantee the time off. Consideration has to be made of if someone else is already off and what else is going on the days that have been requested off. If you have arranged for coverage for the requested days, please make sure you have initial signatures of both you and the person covering your days off. We have requested that our providers, specifically hygiene, and those who assist the providers, find replacement. At times we're not fully staffed enough to find that replacement, and we have not been saying no to any request off because you can't find replacement. But the sooner we know, the better. Requesting at least a month prior, that way we can block the schedule and communicate with patients if they need to be moved. But if at all possible, if it's possible to find somebody to replace you, you'll for sure get the time off. Any questions about time off request? And I'm going to show you the new form. The new form, it looks almost the same. It just has the finance director receiving it before the admin coordinator, which is also the scheduling coordinator in the different offices.
The month notice, is that like ideal, but understanding that sometimes things, okay.
Absolutely. Yeah. The sooner the better, but we know there are times that you've made every effort to let us know soon enough and you have a doctor's appointment or something. Yeah.
There was a time Gina was wanting to request off,
Mhm.
and those days aren't filled yet. Could that be an issue? I don't need to find a replacement for that, do I?
Have you sent me a time off request?
Not yet. Not
Okay.
yet.
Well, it surely makes it easier if they're not filled yet. Get that to
Okay.
us and it gets through the
Probably get
order
to
and then gets, yeah.
Perfect.
Yeah. Okay, very good. Okay, treatment presentation. We want to talk about treatment presentation. After Dana came, well, we worked on kind of creating a little video to show you how to use some of the things that she taught us. Page 3 of your agenda today has some of the things that we're really, really hoping to show you. So I'm going to kind of read through this with you, and then we're going to watch the video. I don't think it's drastically different than what you're doing, but I think that there's some things will stand out to you, maybe certain verbiage, and maybe some other things. So treatment acceptance starts with clear communication from the doctor to the patient. Once the doctor leaves the room, the assistant or hygienist will present the treatment plan to the patient. You will see that they sit right in front of the patient so that they are almost knee to knee. The treatment plan is on a clipboard that is turned completely towards the patient, so you'll need to be very familiar with what's being presented, even, especially if you cannot read upside down. You will acknowledge that this is what the doctor discussed, making sure to mention the reason for the proposed treatment, for example, active decay, cracked tooth, missing tooth, or periodontal disease. Then you will clearly state, this is what your total is, this is the amount insurance is estimated to pay, this is what we're going to ask for you at the time of treatment. If there's any residual balance or credit, we will settle up at that time. Then make sure to end with, how does that sound? Then look away so they can process. Don't say anything. Wait for them to respond. If they have questions or objections, be ready. Make them feel that their questions and concerns are important to you. Don't ask, do you have any questions? This is a yes or no question and does not keep communication open for you to discover their unique barriers and overcome those objections. Instead, ask, what questions do you have for me? Stay there until all questions are answered. Be ready to build value when answering their questions with responses such as, we do hundreds of these each year. We use a local lab. We custom match to your other teeth and choose the shade together. The restoration will be beautiful. After seating the crown, we will review care instructions. Tell them about how long it will take, but don't give them an exact time. If other objections, use the feel, felt, found. Here are some of the objections. Finances, pain, and fear are the most common. Finances. I understand how you feel. We have patients that have felt the same way. They found that their insurance doesn't have their best interest in mind. Pain. I understand how you feel. We have patients that have felt the same way. They have found that our doctors are very gentle and often very pleased with the outcome and their comfort during the procedure. Fear. I understand how you feel. We have patients that have felt the same way. They found that our doctors are approachable and easy to talk to. They are intentional and careful. They are very conservative and don't do anything that's unnecessary. When all questions are answered, schedule the treatment. Okay, let's get you scheduled. Do you prefer mornings or afternoons? From there, you're using the blocks to schedule appropriately. If they're asking for a time not blocked for that procedure, your response will be, I would love to be able to schedule you on that day and time. However, the doctor sets aside special times for this procedure. This procedure takes about 90 minutes, but we're happy to schedule your seat appointment around that time. This is if a patient were asking for a late afternoon appointment. You'll see it in the video. After they sign the treatment plan and you schedule the patient, instruct them to follow you to the front for a stellar handoff. You will state the patient's name, the treatment that was completed, the reason to return if they have been scheduled, or if they need to be scheduled by the admin team. Make sure to ask the patient one time, what other questions do you have for me? If none, finish up with, okay, great, it was wonderful to see you, have a great day. I didn't correct this, but we did decide asking them one more time, what other questions do you have for me at handoff? We probably wouldn't do that, so omit that from your thing, because you have made sure all questions are answered when they're comfortable in the chair. It's just you and them, and you're there answering all their questions, making them feel very much at ease. So we're going to watch a little video that we put together to see this in action. Let's see if this works.
So Jody, I wanted to talk with you about your tooth on the upper right. You've got a first molar up there, very important chewing tooth. It's had a large metal filling in there for a long time. And what's happening is you're getting some cracks and decay around that filling, and that tooth is at risk of breaking or starting to hurt. And I want you to be able to keep that tooth for life. So here's what I'd recommend. I'd recommend that we do a build-up and crown on that tooth. And we can take care of that very quickly this afternoon. If we don't do anything, the chances of that needing a root canal or extraction are very high. So Jody, what questions do you have for me?
I think I'm good. No questions right now.
Okay. Well, I'm going to pass you off back to Sydney. She's going to take it from here, put the treatment plan together, and go over that with you. And she'll be glad to answer any questions that you have. And don't hesitate to reach back out to me if you do have further questions or discussion.
Okay.
Otherwise, appreciate the opportunity. Have a wonderful rest of your day.
Thank you very much.
All right,
And
see
you
ya.
have a good day too.
Bye.
Okay, Jody, this is the treatment plan that Dr. Davis discussed with you about that tooth on the upper right that has that old filling in it with the fracture and the recurrent decay. So this is the buildup part, and this is the crown part. So once we remove the old filling, then we have to fill it back in. So we're gonna put the buildup in there so your new crown has something to hang on to. So this is the tooth number, this is the upper right, this is the fee, this is what insurance is estimated to cover for you, and then this would be your portion right here. What questions do you have for me?
Insurance doesn't pay very much, do they? Is that normal?
Unfortunately, some insurances in the plans, they just don't have your best interest in mind versus what the tooth actually does need for treatment to restore it.
Okay, so my part is.
This
sep-
part right
okay.
here, yes.
And, do you ever do those in a couple payments? Or-
Yeah, we do. You can pay half at the time that we prep the tooth, and then you'll leave with a temporary crown that day. And then you come back in about 2 weeks to get your permanent one put on, and then you could pay the remaining half if you'd like.
Okay,
How's that sound?
yeah, that'd be good.
Great. If you will sign this, the saying that I went over it with you, you're not committed to the treatment, it's just saying I reviewed it with you. Perfect, thank you. And then Dr. Davis mentioned that he could do it today. We have time. Are you available? Would you like to stay and get that done today?
Yeah, I could probably work that out.
Okay, great. Well, let me let him know, and I'll get you on the schedule, and we will get a few things set up, and then we'll get started.
All right,
Okay.
thank you.
Okay, Jody, what questions do you have for me?
Does it hurt?
So our doctors are very gentle, and we actually use a numbing gel that is made at a pharmacy, so it's very strong. So no, not a lot of patients feel any pain.
Okay.
Any other questions?
I guess that's good. No.
Okay. If you'll sign this for me, this is just stating that I went over it with you. Thank you. And then we can go ahead and get you scheduled. Do you prefer mornings or afternoons?
Afternoons. I work till 4.
Okay.
Um,
So the doctor sets aside specific times for this type of procedure. So we have, we do have a spot in the afternoon. The latest we could do is 2 o'clock, but we could do the crown seat appointment at 4.
okay,
Would 2 o'clock work for you?
okay. Yeah, that'll be fine.
Okay, we'll do 2 o'clock on April 10th if that works, and then we will do your crown seat at the 4 o'clock appointment, so that's more convenient for you.
Okay,
Okay?
sounds good. Thank you.
Okay, Jody, do you have any questions for me?
Really nervous about this. Is that normal? Is
Yeah.
that, I mean, I don't like going to the dentist.
Yeah, a lot of patients feel that way, and they found that our doctors are very gentle. We also offer the nitrous gas, if you're okay with that, and they're very conservative with their treatment, and they don't do anything that's unnecessary.
Okay, well, that sounds reassuring.
Okay.
Good.
If you don't mind, if you'll sign this for me, this is stating that I went over it with you.
Okay.
Great, thank you. And then we can go ahead and get you scheduled if that sounds good to you.
Okay.
Okay.
Sounds good.
Okay, Taylor, today we have Jody here, and we have finished with the crown and build-up on number 3, and she's scheduled to come back to get her permanent crown seated and the decay taken care of on number 14.
Wonderful.
So I'm gonna go ahead and hand this to you.
All right, thank
And
you.
Jody, Taylor will get you all taken care of, okay? It was nice to see you. Hope you have a great day.
Thank you so much. Awesome. All right. Well, let's go.
Moving right along, let's talk about schedule review. Who is responsible for schedule review? Pretty much everybody. Admin assistants, dental assistants, hygienists. So here are the specific things that come out when it comes to, we talk about schedule review. Admin assistants are verifying insurance, preparing financials. They are also, when they're in that screen, they're verifying the correct procedures and providers as much as possible. But primarily, they're looking at insurance and financials, and the only way they can get the financials right is to have the right codes and be, planning on what that patient is coming to do that day. So for the most part, our admin assistants are only gonna dig into the chart and go to the narrative if something doesn't make sense. when they see something on the schedule and they see a crown and a build up, they're gonna move forward. If they see just a crown, I hope that they go, why is there not a build up here? And they may go dig deep and find out, oh, the build up was done on another day. But they're clued into that. Dental assistants are reviewing the schedule when they're preparing appointment slips, getting the cassettes ready, lab cases, dental supplies. As you're preparing, you're also thinking, does this make sense? Why are we doing, am I missing a code? So as you're going through those steps, think schedule review. Do I have the right codes? Do I have the right providers? Thank you, Catherine. Hygienists are working to prepare for the next day by thinking who needs radiographs, who has unscheduled treatment, who has idiosyncrasies. So looking ahead, thinking about the next day and what could be coming, and basically getting those schedule blocks ready so that when the patient comes in, that the codes that are attached to that schedule follow that patient all the way until they walk out. So I want everybody to be involved in that from their area of expertise. Any questions about that? Quick review out of sharps and red bags. And so sharps that go into the sharps container are used needles, blades, and burrs. Is there anything else that somebody wants to identify that goes into sharps? I think that's it. Biohazard waste, this is what goes into a red trash bag. Anything with blood on it or anything, blood in it or on it that is being thrown away, it goes into the red bag, not the regular trash. Anything that is saturated with saliva that can be squeezed out, be thrown away. I hate that part. But so a 2x2 that has a little saliva, put it in the trash. Unless it has blood on it, that goes in a biohazard waste. Don't stress. I mean, if you get some gauze that shouldn't go in a biohazard waste and it does, no big deal. But be mindful because we pay weight. When they come up and take our red bags, they weigh it and they charge us that way. When the bags and sharp containers are full, the entire thing should be put in the big red trash can. This is for Chattanooga that lives in treatment room 11. You guys have your box that it gets put into. Please tie off the red bags so they don't start stinking, because that definitely happens. Please lock the sharps containers so sharps don't spill out, and then put the whole thing into the red box or red bag. Everything else can go into the trash can. Please be mindful of putting the correct thing in the right place. Any questions about red bags and sharps? Okay. Lead aprons and thyroid collars. Update ADA release. That's page 4, I believe, of your thing if you want to read about it. But basically, they are not recommended. They are not necessary any longer. They have reviewed studies and expert panels determined that lead aprons and thyroid collars are not necessary. Any questions about that? Okay.
A lot of the older people want you to put a thyroid collar on.
If they ask you for one, you can say, I'd be happy to put one on you when I let you know. According to the latest research, they are not necessary, but if it would make you feel more comfortable, that's very important to me. Your comfort is important to me. I'd be happy to put a thyroid collar on you. So we'll keep them around, and it's going to phase out just like other things do. All right. So, but do feel confident to communicate to them that the latest research says this, and this is why I didn't offer it to you. I want you to know that your safety is important to me. So the way you communicate is important.
And some people have to take medication for their thyroid, and they're very concerned about that. That we covered. Yeah.
If they are concerned, you want to ease their fears. Not in a know-it-all manner would you ever say, well, you don't mean it. But, the tone, what is communicated to them, the way it makes them feel, that's what's important. Alrighty. HIPAA reminders. Any paper that contains PHI needs to be put into the shred bin. If other items like baggies or models contain PHI, we need to find another way to dispose of them. Because when they take their shred bin, they shred it through this big thing and then it goes to recycle. So we may need to consider, if there's a lot of that, a way so we can talk about that. But just for now, anything, even a sticky note, if it has somebody's name and birthday, or, it has to go into the shred bin. Any questions about that?
Just a reminder, especially since we have some new hires, that on the screen, when we have the schedule up, Control H will hide the names.
Okay.
Because otherwise, those screens are often very readable, visible to patients that are sitting in the chair, and so we have to keep the names hidden.
Thank you for that. Control H will hide your name, hide the names, but not hide anything else. Very helpful. All right, handling core whitening outgoing lab cases. Prepare the case in a box to be mailed as usual. Place the mailing label onto the box. Secure the label completely with tape, and place a sticky note with the patient's ID number, not their name. And so that box ended up going to me, and I'll take it to USPS. And that way, I'll know exactly where to put the tracking number. Once I've mailed it, I go into the chart and I'll put that tracking number so we can track it if needed. Awesome. Okay, let's talk about new patients with extensive restorative treatment plans. If a new patient has an extensive treatment plan following a comp exam, the preparation and presentation of the restorative treatment plan may cause them, the patient, to miss out on the appropriate dental hygiene procedure for the second hour of the new patient appointment. If this is a concern, they may have to be scheduled to come back for a 20-minute consultation to discuss the comprehensive treatment plan so that the hygienist can start on time for the second hour of the new patient appointment. The return consultation appointment would be scheduled as assistant time with the assistant that was with the patient during the comp exam. Good notes needed here so that there's no question about this appointment when teams are doing schedule review. So if you were the assistant in the room with the doctor, you got to hear it. You got to hear it and you got to take it down and you got to make that treatment plan. You are the best one to present it. We really shouldn't be asking another assistant to present it, or an admin team member, or a hygienist to present that treatment plan. That should be that assistant. So this hopefully is rare, but it happens. Somebody comes in and they've got a really extensive treatment plan and you're like, oh, this is gonna take me some time. And if I sat and got it all done, this patient would be late to hygiene. The rest of the day would be off. Communicate with that patient and say, Mr. Jones, I'm gonna need to spend some extra time with this, preparing this treatment plan for you. I wanna make sure that it is prepared correctly and that I can present it to you in a way that all your questions can be answered. We're gonna go ahead and have you spend time with the hygienist, and we'll need to bring you back. Here are the options. So schedule that patient on a day that you're gonna be in, and you can take that time. And go ahead and, this is a good opportunity to talk to the admin coordinator and say, hey, I need to block this time here because I can't assist Dr. Davis at this moment. I'm gonna be talking to this patient about the treatment plan. So, he's gonna have one assistant in this little moment of time. So talk to your admin coordinator if a block needs to be put on the schedule. Does that make sense?
Occasionally, as a hygienist for 2 hours, I have come across that, and I have another patient right after. If it's like lunch, at the end of the day, I can usually make it happen, but is that 20-minute, it won't be often, but is that 20-minute consult, should that be with the hygienist again? Or is that something that would be appropriate to pass on to the doctor and assistant?
If you were the one in the room for the comp exam, taking it down, you were the one listening to the reason for the crown on this, or then it should be you. So, and I know we don't want to take up that full hour, so maybe look on a day that you've got a perio, and that's gonna take, 90 minutes, and see if you can put that patient to come in right after that, something like that, or a child prophy, or something where you might have a good opportunity. And if worst comes to worst, we really want to get that patient back in to have that treatment plan within a week. We don't want it to be 2 weeks out because it needs to be fresh on their mind. Or otherwise they're going to be like, did they forget about me? Or how long is it going to take? Is it really that bad? Okay, how are we doing? Oh boy. Crown and build-up treatment planning. Okay, I want to show you this. Okay, this is new-ish, but this is not new. Must have a PA before the crown and build-up is even started. Absolutely. If we want insurance to even consider paying for this patient's crown and build-up, we absolutely have to have a PA. So we're asking that the assistants have the PA of the tooth that will be prepped on the screen when the doctor comes in to start the procedure. If you don't have one that you can put on the screen, that's your clue. Take one. Take a PA day of prep day, so that it can be up on the screen and we can know for sure we've got that to send to insurance whenever we're sending that claim. Okay, rewind to the day that the treatment plan was presented to the patient. Here's what we'd like to start presenting to patients. Treatment plan that includes the PA, the crown and buildup, and then the final bite wean. Reason why we really want to have these on the treatment plan is because sometimes the patient is going to be responsible for these. We don't know when. We don't know when they're gonna, oh, that's it. The insurance isn't gonna pay for any more PAs. We can't know that with certainty. So, because of that, as you can see, the insurance is zeroed out for those 2 images. And I would go into detail. I would say these are required images that we need to take so that we can, so your insurance will pay. Your insurance requires that these are sent with your claim. Feel free to tell them that. That we cannot be certain whether your insurance will actually pay for these images. If they pay, that's great. If they do not cover the expense of these images, they are your responsibility. So, you guys probably know how to do this as you're creating the treatment plan, and it should be all into that exploding code where it's phased out just like this for you. But you're gonna have to go in and right click on the fee for those 2 images, and where it says estimated primary, you have to turn it to 0 on those before you print your treatment plan. That way it will print it out with no insurance coverage on that, those 2 images, so that when you present it, come back here, the patient portion is going to be correct. Patient is $751.50. Does that make sense?
Why would we be presenting a treatment plan with a PA on it?
If there's a PA, yeah.
When would we be doing that? Because we're never gonna diagnose a crown without having some sort of, almost never diagnose a crown without having some images.
It has happened.
Exactly.
So and we've had insurance deny. So we're trying to,
So if we just got done with the problem focus exam and PA, then a new treatment plan is not gonna have the PA on there, or do you want it on there again?
we're trying to cover ourselves and go ahead and put it on there. Very, very, very likely, 99% of the time.
So we're not gonna charge it out if we're starting that same day or within a few weeks or even the next 6 months, but if they come back 6 months, 12 months later, then we're probably gonna grab
Right.
a new PA.
Because what we walk out is what we actually do. This is showing the patient what we plan to do or we might need to do. This is a might, so we won't actually walk this out unless we do it.
Right, if we don't need it, it's gonna come right back off and it's not gonna be billed out to them.
That's right. But it gives them a heads up that, hey, a pre-image may be necessary. Really shouldn't be, because we, like you said, we shouldn't be
And
diagnosing.
for me, I kind of said 12 months is what I'm looking for. If we hear some information back from insurance saying they need something more or less frequently, we can possibly adjust that, but that's a good cutoff for me. I think
Okay.
our best is asking for 6 months, so just kind of keep that in mind. If it's been 12 months or more, we don't have a PA.
We should do something across the board. So I think maybe you guys can talk about that, and we'll have a standard 12, 6, whatever that wants to be, so it can know. So PA within, let's say 6 months. PA within 6 months.
What about the cash pay?
DSP or the cash pay patients?
No, it'll be covered.
Yep, covered. All images covered on your DSP patients. All right, any other questions? Okay, I'm gonna fly through some housekeeping updates. Chattanooga, I'm gonna just go through them all because sometimes you guys are there. Every team member should have one locker that is labeled, so we know whose it is. Items that are in an unlabeled locker will be removed during spring cleaning. This is liable to happen at any time when the cleaning organizational bug bites someone. Admin team members may choose to claim an empty drawer instead of a locker, only if the drawer is not needed for admin supplies or files. Hickson, a hygienist and assistants each have a locker in the kitchen. Admin team members may use an empty desk drawer. Trenton, each team member claims a black bin in the break room. Please label. Tape. Tape is a destroyer of joy when it is used anywhere besides closing up a box to be mailed out. Tape leaves a sticky residue that is very difficult to remove, so please, please, please do not put any tape on the walls or desks or anywhere. If you need to put something up, please use a magnet if you're able, or ask me, and I will get you something that is surface friendly and does not kill my joy. I've spent a lot of time getting sticky residue off of things. So thank you for that, for that one. Work areas, please leave your work area tidy for two main reasons. The cleaners will have access to dust and clean the desk and countertops because they don't move our things. If we leave papers or things on the desk, they will clean right around them. They won't be dusting those areas. And because we absolutely love things that are tidy and organized. So please help us out with that. Okay, and last thing was just a reminder about the new patient coding, which that went out, and I think that, you know, it's a reminder how this works, or if anybody has any questions, I'm happy to attempt to answer your questions. The 7 codes that are needed on a 2-hour new patient appointment, especially when they're with hygiene. If you turn the page, it'll have the 4 codes if the patient is only being seen on the doctor's side. Then just to clarify, no ghost codes needed for DSP, and on a child, new patient, we do Panorex and bite wings, no ghost codes are needed. I know people were asking about what happens when it's time for a new set of x-rays. When do we repeat the FMX and Panorex? 3 to 5 years later, we'll do both the Panorex and the FMX, charge them both out at that time. The patient is financially responsible for whatever is not paid by insurance. This needs to be communicated to the patient. So when you're seeing a new patient, it's been 3 to 5 years since their FMX and it's time, you need to let them know it is our standard that we do both an FMX and a Pano. It's the best way for us to be keeping an eye on things. We will send both of these to your insurance. It's very likely that they will only pay for one. The other image will be your responsibility.
And that's just a returning patient, not a new patient.
So that's that returning, oh, that's right. If they're a new patient,
You write it off.
we are doing this. Yep.
We're doing that universally so that new patients, there's consistency and we can get the images we need, but we're not billing them for both the Pano and FMX because insurance will not cover both, they only cover one. But we want to get those across the board, and so it's just something we decided to do for all of those patients.
That's right, our new patients as they're getting established with us. Okay, well, any questions about any of that or anything that wasn't mentioned that you might want some clarity on?
I can just see people with the next time we take the FMX in hand, they're like, oh, I'm only gonna pay for one, so let's pick one. I see people saying that.
So what you as you're discussing what you're gonna do for them that day and letting them know.
I would focus on the fact that we're doing it complimentary this time at the front. You don't have to go into what's happening 3 to 5 years
Oh
from now.
no, once we hit that 3 to 5 years.
You're saying complimentary on the new
And they're
patient.
gonna be like, wait,
Stress that it's complimentary.
yeah.
And then when they come in.
Then you could bring that up. You could say, well, you may remember that we did this complimentary for your new patient appointment. But as our standard of care, states that these are necessary images for us to.
Because patients are often, we're trying to meet them kind of in the middle, they're expecting to come in as a new patient, oh, insurance is gonna cover all that. So we're trying to minimize upsets, oh, here's an additional $119 out of pocket or whatever. But when we get to that 3 to 5 year mark, it's gonna be customized more to their specific situation, how much work we've done, how much work we've not done. And once again, if we're hitting that frequency, they're gonna have insurance coverage most likely for one of them. And so their out of pocket is still gonna be not the full boat, it's probably gonna be picking up a panoramic or something. Very case by case.
Right. And if the patient insists on, only what insurance is going to pay, how would you handle that?
Well, once again, patients coming to us new, they don't know us. We want to be able to win them over to want to love us and stay with us and not go anywhere else. When they're brand new, we don't have that rapport with them. We don't have a history with them. But if we're building up value, we're taking care of them, we're pouring energy into them over 3 to 5 years, we hope we get to that point and they're going to say, you know what, Thank you, Kendra. Thank you, Tamara, for taking care of me. We love it here. We're not going to whatever you need to do. So,
I think we built that with some,
absolutely.
yeah.
Awesome. Well, I need to let you guys go. Thank you so much for being part of the meeting
Thank you,
today.
Christy.
Yeah.